Hi, everyone. Today I'm going to be looking at how artificial intelligence is being used to fight COVID 19, the coronavirus that has been classified by the World Health Organization as a pandemic because it has now ravaged the whole world, literally. Cases are springing up in every other country across the globe. So, we're going to look at 10 ways that AI is being used to fight COVID 19. Thank you to Andrew Quixley of IT Web in South Africa for an amazing article that we're using to base our discussion on. So, the first one is identifying the outbreak. So, AI is being used to identify the outbreak. That is, early awareness is critical when stalling a disease outbreak, right? And as we know that in China, in Wuhan, there were a group of doctors that discovered this virus and alerted the authorities. But then the Chinese authorities tried to cover up the spread of this or the emergence of this virus, and that did not help the whole situation because now it has spread to all corners of the globe. If only they had acted when the disease was still in its nascent stage, then maybe we might be talking of a different story. Maybe we would have been better prepared to deal with COVID-19. So you'll find that there's a gentleman called Kamran Khan who founded a company called Blue Dot, which was a reaction to the SARS epidemic that happened in 2003. So Blue Dot's algorithm, the way it works is that it hunts for outbreaks by scanning the landscape, that is looking at foreign languages and news sources from all over the globe, and also looking at the global airline ticketing data to predict where the disease is going to spread next, right? So, according to CNBC, Blue Dot detected the outbreak in Wuhan and warned its clients on the 31st of December 2019. So, this is AI in action where we are using high performance computing and machine learning algorithms to actually identify the outbreak of the virus. Then the second use of AI that Andrew lists in his article is that predicting the spread of disease. So now prediction is probabilistic, and obviously an epidemic is a multivariate complex system of systems with millions of variables, right? So it would be too complex for human beings to predict using their traditional means, right? So basically, AI is being used to look for patterns, to look for relationships that can help in predicting where and when and the veracity of the spread across the globe. So you find high performance computing running machines are suitable for modeling such complex scenarios and producing algorithms capable of predicting outcomes when the variable change, because the spread of disease is dynamical. It's not static. It's not deterministic in a way, right? So you need predictive analytics to forecast. I know in Australia they're using a lot of forecasting algorithms to try and understand where which course the COVID virus would go based on the epidemiological studies that they're taking there. Then the third use of AI that is outlined in Andrew Quixley's article is that they're tracing people who have been infected, right? So tracing people who could be infected. So It's first of all people who are actually infected and people who could be infected. And this, they're using a social network analysis method where if you check, you'll see that the early containment stage for COVID 19 involves tracing anyone who might have been in contact with an infected person or in the vicinity of the pathogen and isolating it. So, China's exceptional advances in statewide surveillance technology and their national database of faces enabled them to track one individual from Hangzhou, first through automated number plate system, and then later through automated facial recognition when he breached his own self-isolation. So I know, yes, you could be saying, but no, China is a dystopian state. It's a surveillance state. It's breaking the human rights of people. But here they're highlighting the pros of having a surveillance system. So I'm not sure if other leaders in the world will be looking at this and saying, oh yeah, so now we can justify having a surveillance state because look, China was able to use it productively in trying to solve the corona case, so it's justifiable. That's another debate for another day, whether we want surveillance states or not. Then the fourth one is communicating with citizens, because you find in any crisis, the lack of information is what leads to panic. It's what leads to craziness prevailing, right? So it's important for the citizens to get just-in-time updates as to what's happening with the cases, what's happening around the coronavirus. So you find because of the anxiousness of people, the call centers to hospitals, to doctors' rooms, and stuff like that will be inundated with calls, and they might actually not be able to help everybody because the volume is just too much. So AI comes in now where, like for example, in the UK, NHS 111, the number for the UK's National Health Service helpline, introduced a digital version of its helpline and said, okay, we're going to use an AI-powered chatbot and an online symptom checker to remove the burden from call centers, hospital ERs, and doctors' offices. So in the first 5 days in service, the online service, the chatbot, handled more than 1 million inquiries, and that would never have been achieved with human agents in a call center trying to assist all those panicked citizens. So that was the fourth one. Then the fifth use of AI that we're saying is the diagnosis for infection, right? Where we're saying AI-powered image analysis is being used in China to speed up the process of CT scans, enabling a diagnosis to be achieved in 15 seconds and with an average accuracy of about 90%, compared to the 15 minutes for a human radiologist who, because of bias and noise that human beings inherently have, wouldn't be as consistent as an AI. And the good thing is that the more cases that the AI deals with, the more prolific it becomes. So it's learning as opposed to human beings who are very subjective in a way. So in China, right, they actually repurposed as a system that was designed to spot lung cancer in CT images. That is the company that did that is called Ping An Smart Healthcare. And they have been able to deliver the COVID-19 smart image reading system, helping triage 5,000 new cases in more than 1,500 locations in the first 2 weeks of operation. Talk about scaling an intervention. So that's AI in action there. Then the sixth one is finding an effective treatment. So deep learning enables pharmaceutical researchers to predict the characteristics of new chemical compounds that don't exist yet, or predict which existing molecules might be effective against a new disease. And that substantially reduces the lead time to developing a new drug. So last week, researchers using the Oak Ridge National laboratory supercomputer to test how 8,000 chemical compounds would interact with COVID-19 virus. So they identified 77 compounds that could help with future research. There are already successful precedents in drug discovery. Like for example, researchers from MIT, that is Massachusetts Institute of Technology, recently published a paper in Cell describing how they used AI to discover a powerful new antibiotic named halicin, capable of killing many of the world's nastiest pathogens. So that is AI in action in the healthcare sector there. Then number 7, enforcing the quarantine. Because you see, it's easy to say we're going to quarantine people, but enforcing and making sure that people adhere to the quarantine is another thing altogether. So China, for example, it's deploying AI-powered unmanned aerial vehicles, that is UAVs, smart drones that are going into places that police would never be able to get to, and they are also having an aerial view. So definitely that helps. So smart survey drones are now being retooled in China to police quarantined areas from above, to perform decontamination protocols, and to deliver lightweight essential supplies. A report in South China Morning describes the initiative in detail. So these drones have now become useful. They are doing surveillance from up above. They're delivering essentials. They are also helping with the spraying of decontamination chemicals. So number 8, we are talking about delivering essential supplies on the ground. So that's the one that we mentioned in 7 as well. So the mobility sector is another casualty of the lockdown in China. But driverless vehicles have taken over where humans are prohibited. So now you find that driverless vehicles are being used as logistical resources that are resupplying hospitals in infected areas. And also autonomous robots are now delivering meals within hospitals for more than 40 Chinese cities. And this report from the World Economic Forum describes how autonomous vehicles, autonomous robots have literally saved the Chinese healthcare system, because otherwise most of the doctors and nurses would have been affected or infected when dealing with the coronavirus. Then number 9 is something that is a pandemic already. That is fake news. So we can use AI to eliminate fake news associated with the coronavirus, because there have been so many conspiracy theories and fake remedies that have been flying on social media and beyond. So it's important to try and filter out the bad news, that is fake news, and dangerous advice. So AI is being used to flag fake news by learning which websites are more authoritative, identifying posts that use sensational languages or images that don't fit with the right date and location for the story they support. Scott Tong explores the details published in last month's marketplace. So that's Scott Tong, who is going to look at that in detail. Okay, so the last one is managing complex supply chains, because with the lockdowns that are happening in China, with all the restrictions and the quarantines and all that, there is now a need to efficiently manage the complex supply chains. So empty shelves are a familiar sight already because of panic buying of things like hand sanitizers, masks, face masks, medication and stuff like that, right? But if you check, because China is the manufacturing hub of the world, basically. So that means whatever is happening in China, if there's a slowdown in the manufacturing, then the whole world suffers, because now supply chain systems have been messed up, right? So we're seeing that there is a way that AI is being used, which is to reboot the global supply chain, and they are using optimization methods to see how what is the quickest way to get materials from China to the rest of the world in the most efficient fashion. And so because there's so many variables at play, and AI is being used to solve that problem. So yeah, so these are some of the ways that AI is being used. And if you know of any other, please comment, and I will add them to our list of amazing ways that artificial intelligence is being used to help solve the coronavirus, that is COVID-19 crisis. So stay safe, wash your hands, create the safe distance protocol, and read on the WHO website on how you can protect yourself against this virus, because this virus does not discriminate whether you're rich, poor, black, white, blind, or whatever, right? So you have to make sure that wherever you are, wherever you are safe. So thank you very much. Take care.